Hey y'all, my name is Oreofe and I'm a third-year medical student at Howard, and in this video I'm going to tell y'all how I studied for the USMLE Step 1, specifically how I was able to improve my score by 54 points. When I took my first practice test, which was the CBSE that my school administered, I got a 183, but during my dedicated study period, I was able to increase my score to a 237. This isn't a guide for the people who go into dedicated already having a 240. This guide is for people who want to see improvement and see growth. Now that step 1 is pass fail, we want to be able to not only pass, but comfortably pass. So I'm just going to get into the video. First and foremost, I wanted to talk a little bit about the mindset that you should go in with when you're studying for step 1. Personally, I went in with the goal to make failure almost impossible. Considering the specialty I'm interested in doing is more competitive, I don't want to have a failure on my USMLE transcript. Because when your score is pass-fail, they don't know how well you passed, but if they see that you failed, they automatically know that you were in the bottom 10% of test takers, and if you want to do something competitive, that's a no-go, which is why I said I don't want to just pass, I want to comfortably pass. So in my head, my ideal goal was to get something around a 230, which is what the average was before step 1 pass or fail. And in addition to that, I wanted to keep working until my NBME self-assessments, which is one of the practice tests you can take, said that I had at least a 99% chance of passing. And in addition to trying to get a comfortable score, it's important to also remember that this is a time to learn. This is the only time you have to truly revise these topics from the past 2 years of medical school without any sort of interruption. And in addition to that, step 2, which is still a numerical score, builds on topics that you learn during step 1, as well as third-year rotations. At least go in with a mindset that you want to learn and try and be a competent and knowledgeable physician in the future. And the last thing concerning mindset would be that just because the exam is pass-fail does not mean that it's easy. Step 1 is a beast, so you need to treat her with respect. And the main reason I'm saying this is because if you look at the statistics, between 2021 and 2022, step 1 pass rates have dropped. And yes, that could be partially because they increased the score required to pass from 194 to 196, but it can also be because some people may have not gone in working as hard because they thought that since they just have to pass that it'll be easier. But step 1 is not easy. She has never been easy and she will never be easy. So just keep that in mind. You're going to have to work hard. So now I want to talk about the things that I did before dedicated, and then later I'll talk about my schedule and what I did during dedicated. So the first thing that I'm so glad I did before I started dedicated, and this was mostly during my second year of med school, the entire year leading up to it. The first thing I'm so glad I did was familiarize myself with resources. That way, during dedicated, you already know what works for you, as opposed to jumping around between 20 different resources and you're not truly absorbing anything from the ones that you use. So I can talk a little bit first about the resources I use both before and during dedicated. First and foremost, I want to talk about UWorld. I would say UWorld is the only non-negotiable resource that you should use. And if you don't know what that is, it's a question bank and it's the gold standard for step 1 studying. And I use UWorld both during dedicated and throughout my M2 school year. And I think it's really important to familiarize yourself and get comfortable with that style of questioning well beforehand, especially if you go to a medical school that uses NBME exams for their school exams. And I say that because medical board exams have a certain style of asking questions. They don't just ask you things outright most of the time. They give you a vignette and they give you the patient's age and what they came in for, and then they ask some random itty-bitty detail about the diagnosis. And in addition to that, they'll have different buzzwords. So getting used to that question style ahead of time is going to help you out a lot. That way, when you get to dedicated, instead of trying to hone in test-taking techniques and trying to understand what UWorld is trying to say. It's more so trying to understand the content itself and understand key distinguishing features of different diseases. So before dedicated, I finished only about 39% of my UWorld, and this is what I did throughout the entire school year. And then at the beginning of dedicated, I restarted my UWorld. That way I can see all those fresh questions, especially the pathology ones, because I was eating those questions up a lot during the school year. I'm editing, y'all. Sorry, I forgot to mention, after I restarted my UWorld and during dedicated, I only finished about 2/3 of the question. So I think 67%, and I got about 65% of them correct. So try and finish as much UWorld as you can. Just the way it worked out for me, I was only able to finish about 2/3. The next resource I want to talk about would be first aid. In addition to UWorld, first aid is the other main resource I used during my dedicated period. But during the school year, I actually wasn't a big fan of it. And this is why. First aid is very much a review book. It'll be throwing out acronyms as if you know what they're talking about if you read it before trying to learn it from other sources ahead of time. But I do think first aid gives a good snapshot and helps jog your memory about things once you've already learned it. And first aid also has a bunch of nice mnemonics. I would say some of the first aid mnemonics are trash, but some of them are good. Take what you can get from it. So yeah, it's definitely a good review book, but not the thing that you should learn from foundationally. The next resource I'll talk about is my favorite, Pathoma. This is a pathology book. I loved Pathoma for during my M2 school year because we were mostly learning pathology. It does things in detail, has plenty of images, and I really like the way Dr. Sitar teaches. So it's not just a textbook. This one has videos associated with it. And I know I'm showing you these physical books, but I actually had them on my iPad. These are both 2017 versions that I just happened to pick up a long time ago, but I mostly use my iPad for them. Pathoma definitely gives you at least 90% of what you need to know for pathology. And the first 3 chapters are very high yield for step 1 in particular. So during my M2 year, I would read a Pathoma chapter and I would do the associated Anki deck, which is called Duke's Pathoma. I really love Duke's Pathoma because it helps you to allow the things that you read to stick. That way you can start to actually process things. However, as far as my dedicated period, I didn't use Pathoma that much because I had already gone through the entire book during the school year, and I only really used it if I remembered, oh yeah, the Hemonk chapters for Pathoma were really good for me. They really helped me out. So I only really went through a select few chapters during dedicated. Another resource I used was Sketchy Micro. Sketchy also has pharmacology and pathology. Sketchy Path, please, it's okay, don't do it. But Sketchy Farm, some people do really like. I just personally didn't really have the time for it. But I did love Sketchy Micro. I did most of the bacteria during the school year. I didn't really watch the videos during the school year, but I did do the Anki deck for it. The one I did was called the Pepper deck, and I kind of did it when I had to cram a bunch of bugs very quickly. But during dedicated, I actually did go and watch all the videos in Sketchy Micro, and I found it very helpful, especially when I did the Anki in addition to it. And if you don't know what Sketchy is, it basically gives you a story. It paints a picture. It's a really crazy picture, but it helps you associate different things with a certain drug or bacteria or virus or fungus or whatever. I don't know how to explain it, but you gotta see it to know what it is. And the last resource I really liked, especially during the school year, would be Boards and Beyond. And I also used it during dedicated, but more as a supplement to first aid. Or if I was doing UWorld questions and I was like, I really suck at this certain topic, then maybe I would watch the Boards and Beyond for it. Boards and Beyond is a video lecture series by Dr. Ryan. And I believe if you get the subscription, they also have different practice questions. I wouldn't say Boards and Beyond is as fun to watch as Sketchy, but it really does go through the high yields of certain topics and explains things in a way that you can really break it down and understand. So those are the main resources I use. Now let me talk about some other resources that exist that I didn't really like. Amboss, I wasn't a fan of. Med School Boot Camp, I tried out, wasn't a fan of. Kaplan, I only like the pharmacology portions of the Kaplan books, like the first few chapters of Kaplan Farm. But aside from that, I didn't really like it. from what I saw. And I only did a bit of Anki. The Duke Pethoma deck and the Pepper deck are all I really did for Anki. For some medical students, Anki is their holy grail, but that's not me. And the only way I know that I don't like these is because beforehand I was able to try them out. And because I was able to figure out this is what I like, this is what I don't like, when I went into dedicated, I wasn't confused, I wasn't overwhelmed, I knew exactly what I was about to get into, and I wasn't wasting time trying out 20 different resources. Another thing I wanted to mention for before dedicated would be to just try your best to do well in school, especially during M2. It does depend on your school, but whatever year y'all are learning the pathology as well as physiology, pay attention in school. And if you do that, you're going to be able to pick up on the medical lingo and clinical findings that are going to be important for you to be able to recognize on actual test questions. For example, if I say on percussion of the lungs, there's hyperresonance, you should know, okay, maybe this is emphysema, maybe this is pneumothorax, depending on the clinical scenario. If I say there's a hollow systolic murmur at the 5th mid-clavicular line that's radiating to the axilla, you should know that I'm talking about mitral regurgitation. These things are gimmies. You should be able to pick up the gimmies because oftentimes they won't ask you about the gimmies, they'll ask you about something else related to it. So the questions are usually second order or maybe third order. But in order to know what piece of information they're looking for, you're going to need to know exactly what they're describing. And that only comes with paying attention in school and trying to do well and getting in those practice questions early. Let me get comfortable, y'all, because now we're going to talk about during the step 1 dedicated and what you got to do to succeed. So the first thing you got to do is take a diagnostic test and analyze the results. This way you can see where you are, see how far you need to go, and evaluate your strengths and weaknesses. And it's important to know your strengths and weaknesses because you got to start off with reviewing your weaknesses. That way you have more time to master those subjects. But anyway, once you take your diagnostic, the next thing you got to do is make a study schedule. And I don't mean just make a general schedule, like plan out what you're going to do every single day. That way you have a list of tasks and you know exactly what you want to accomplish. I'm going to kind of integrate how I studied along with as I explain my schedule, because I mean it's kind of goes hand in hand. Personally, my goal was to study 6 full days a week. So I would study Monday through Friday, non-negotiable. When I say 6 full days, that depends on how I spend Saturday and Sunday. On Saturdays, I would usually take a practice exam, whether that be the NBME, which are the test makers practice exam, or the UWorld self-assessments. And those tests take about 5 hours at least, depending on whether you take breaks or not. And that's about a half day. So I'll either on Saturday take my 5-hour practice exam and then review it on the same day, or I'll just take the practice exam on Saturday and then review it on Sunday. And reviewing also takes about 5 hours for me. Total, I'll have 6 full days of studying. And on a regular schmegular Monday through Friday, I usually studied 9 to 11 hours a day. And I'll tell you guys in a few why it kind of had that range. So before you even make your study schedule, write out a list of all the subjects like organ systems and other subjects that you want to cover, and look at how long the chapters are in first aid. And based on those chapter lengths, I decided, am I going to spend 3 days on this or am I going to spend 2 days on this? So that way I was usually going through 2 subjects a week. For example, my first week of dedicated, I studied biochemistry and immunology. The biochem chapter is much longer. So I spent my first 3 days on biochem, and then Thursday, Friday, I did immunology. So just write out a long list, see how long you want to spend on each thing. That way when you make your schedule, you can factor those things in. So let's talk about what I actually did. I'm going to break this up into the first half of dedicated and the second half of dedicated because I approached my studying schedule a bit differently. So I usually woke up around 7 a.m. and then I, showered, ate some food, made myself a little drink, and then at 8 o'clock is when I would start studying. My goal, which I didn't always achieve, but my goal was to do at least 80 20 UWorld questions a day. And I'll tell you guys how I broke that up. So from 8 a.m. to noon, I would do 60 UWorld questions. And these blocks would be randomized, timed, and depending on the day, sometimes I would do tutored, other days I would do untutored, and then I would review after. If you don't know, the tutored is you do the question and immediately they give you the correct answer and the explanation. The untutored, they'll just give you the 40 questions straight, and then you'll see how well you did, and then you can review all the questions answers later. Because on the real deal, the thing is going to be randomized and timed. And when I was reviewing these answers, I made it a point not to waste time on things I already knew. This video is telling y'all how to grow your score. To grow, you got to focus on the things you're not doing well in. So if you already know something, just be like, okay, got it, move on, or quickly read the table or skim through the explanation and move on. Otherwise, you're not going to be able to get through that many questions. I'm not saying do a shabby job going through it. I'm saying spend your energy on the things you're not strong in. And I just want to say something real quick about tutor mode. The thing about it can be good because at least when you're finished, you know, okay, all the questions are reviewed, I don't have to do anything else. But it can have some negative mental ramifications, especially if you're doing poorly in the first few questions. It's like ding, 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 hit, hit, hit. And it can kind of mess with your psyche a bit. So if you're not mentally strong enough to do tutor mode, just do it untutored. Anyway, that's what I would do from 8 a.m. to noon. Then from 12 to 1, I would take a break, get some lunch, you know the deal. Then starting at 1, I would do about 4 hours of subject review, and sometimes I would take a break in between there, but usually I'd spend 4 hours of content review. And this usually consisted of reading through first aid. And if I had time left over, I would maybe do boards and beyond to supplement topics I wasn't sure of. Or if I don't feel like reading the pathology part of first aid, and I remembered, oh yeah, the pathoma chapter for GI was really good, I may watch the pathoma video. Because remember, I went during the school year and I knew what really worked for me. But nonetheless, 4 hours content review. So after that, let's say now it's like 5:30, I would do an additional 20 UWorld questions. Remember I said I wanted to do 80 a day. I started off with 60 and then I did 20. And I would do this untimed tutored. For these questions, I'm not doing it randomized. I'm doing it based off the subject that I just reviewed. So if I was just doing renal, I'm doing renal questions now. That way I can solidify my knowledge, see what I remember from what I just studied, and also see how these things present in a question stem. So doing the subject-based UWorld 20 questions usually takes me about 2 hours. I just know from personal experience, I usually go through a rate of about 10 questions an hour if I'm doing tutor mode, and if I'm actually fully trying to learn everything that's in there. But that's just me, it might be different for you. So after that, I would take a break, and then let's say it's 9 p.m. Now I do a 2-hour miscellaneous study block. I said I studied 9 to 11 hours per day because I didn't always use the full period of 2 hours. One thing about me, if I'm tired, I'm gonna go to sleep. So during this period of time, I usually spent it watching Sketchy Micro, or if there was a topic that I was struggling on, let's say during the randomized block, I kept getting questions on HIV drugs incorrect. Maybe I'll watch a video on HIV drugs. You know, just doing those little things to supplement and wind down my day. So that's basically how my Mondays through Fridays would go. And like I mentioned before, on Saturdays and possibly Sundays, I would do some sort of practice test and make sure to take one every week. I took some sort of practice test every week of dedicated except like my second week because I found myself being burnt out pretty darn early. But for my mental health, I skipped 1 week. Aside from that, every single week, take a practice test. Now let's talk about the second half of dedicated, my weeks 5 through 8. So during this period of time, I had an alternating day schedule. So I had A days and B days. On an A day, I would do 80 randomized UWorld questions, and then I would also do those 4 hours of content review. And remember, I mentioned that you start off during dedicated with the subjects you're weaker in. So by the time you're at week 5, you're at subjects that you're more comfortable or stronger at. So for example, I may not need to spend as much time on reproductive. Now I saved it to the end, so I'm just gonna do those types of things on A days. Then on a B day, all I would do 120 UWorld questions, which would be 3 blocks of 40. So I did UWorld and nothing else. As you're getting towards your exam day, you really gotta hone in on those practice questions and getting exposed to as much information as possible. The thing I forgot to mention, on B days when I'm doing 120 questions, 2 of the blocks will be randomized, but for one of the blocks, I'm choosing select subjects. So based off my NBME or UWorld self-assessment practice test analyses, they're going to show you which subjects you're doing better in and which ones you're doing worse in. So if I'm doing really poorly in a certain subject, I'm going to do one of those blocks. I'm just going to choose that subject. So I may do 80 randomized questions, but then for 40 of the questions, I might select, okay, let's do respiratory and renal. That way I'm seeing those types of questions. I'm getting more exposure to the questions I'm weaker in. The main way to grow your score is to get comfortable in the things that you're weak in. So alternating those was basically what I did weeks 5, 6, and 7. Then week 8, which was my last week of dedicated, after I took my last practice test, I'm just gonna go through a list of the random things I did during that time period as a final cram type of situation. I read through the first aid rapid review chapter, and I also did a little bit of the associated Anki deck. I watched Pathoma chapters 1 through 3, which I mentioned earlier is quite high yield for the exam. I did my free 120 exam about 2 days before my actual test. I did all the social science / ethics / communication type questions on UWorld, which I'm glad I did because there were a whole lot of those types of questions on my actual exam. I also did most of the general principles exam questions on UWorld because I kept doing poorly on those for whatever reason on the NBMEs. And I also watched videos on random topics I wasn't that good at, such as HIV drugs, vitamin deficiencies, these high yield things that it's good to just brush over really quickly. I also watched some YouTube videos. There's this channel called Melman Medical. I watched his high yield images videos, which was super helpful just to get those things back in my mind because I may not have seen them in a while. This last week of dedicated should really be tailored to you and what your weaknesses are and what you want to brush up on. But the main things I suggest you do during that last week that are like you gotta do it, that's so helpful, are the first aid rapid review and the free 120. The day before my test, I did study a little bit, but I took about 2/3 of the day off. I only studied from 7 a.m. to noon, and then I took a mental health day for the rest of it. If you want to see everything that happened after I studied that block, you can watch my USMLE test day experience video, which I'll put in the little card. I don't know if it's on this side or this side, but I'll put it up there. So I believe that's all for how I improved my Step 1 score. I really, really hope this video was helpful for you. Share it with your other friends who are taking Step 1. Let me know any other video ideas in the comments, or just say anything you feel like saying. Give this video a like, subscribe if you like my content, and I will catch you in the next one. Adios.
Hey, hey. Don't you see the silver line?